Good afternoon, guys. I'm going to go ahead and get into some regional terms. This is a continuation from the last directional term introduction. All right, so let's go ahead and start with regional terms here. I'm not going to go into each one of these, but this is a good indicator of what you would need to look at and know in the medical field. So what you would do is study this figure for a couple moments and let's answer two of these questions. So the first one here, where would you hurt if you pulled a groin muscle? Everybody knows the groin is in this location, right? So the groin location is called the inguinal area. Inguinal area, because that points right here. Okay. Where would be pain if you cracked a bone in your olecranon area? This is olecranon, or the olecranon is what it's referring to. So if you were to search these terms here, you should come up somewhere along the area here where it says olecranon, right? Olecranon is your elbow. Okay, your elbow. Okay, so these are just some more anterior body landmarks that you could go over. There's a bunch of them, but it has the pronunciations here: abdominal, acromial, etc., and where you would find those. So if you'd like to read that, you can pause the video. Here's some posterior landmarks. So what you would find posteriorly. Calcaneus, for example, the calcaneal area is the heel of the foot. Cephalic would be the head. All right, so as a review from before, why would we need to know the anatomical position? Why is that important? Well, the reason is because it's a reference point for people that you're discussing where they're basically describing them in their location and how they're standing, right? When you're describing a particular structure, regardless of what their actual position is. In this location, it says here, or this question says the axillary and the acromial areas are both in the general area of the shoulder, right? To what specific area do these terms apply? Axillary, I think it's spraying an axe on your armpit, right? So that would be the armpit. And the acromium area, the acromial area is going to be the point of the shoulder, right at the tip of the shoulder. Okay, so if you were going to describe the location of a cut to the back of your left forearm, the back of your left forearm in anatomical language, your forearm, the back of it would be here. Posterior antebrachial region. Posterior left antebrachial region would be your answer. Okay, so let's go ahead and get into some body planes and body sections. So there's 3 body planes and or sections that you need to know. But first, what is a section? A section is going to be a cut that you're going to make through a body wall or an organ that is along an imaginary line called a plane. Okay, there's 3 planes. It goes in the X, Y, and Z axis. That's what we're going to be talking about here. They're all right angles to each other. So the first one I'm going to talk about is a sagittal section. So here's a sagittal section. That's going to be cutting and dividing the body into equal left and right halves. Left and right halves. Equal left and right halves would be called a mid-sagittal section. So that's important to know. When someone says I did a mid-sagittal or a median section, it's talking about cutting them directly in left and right halves. Okay. Sagittal could be anywhere, actually. You could take a sagittal cut here, sagittal cut here, and it would still divide you left and right, not necessarily equal. A frontal or coronal section is actually going to divide you from the front half and the back half, or a cut that's going to divide you front and back. The way I like to think of this is if you drink a Corona, like a beer or something, you're drinking it from the front, so it's cutting you in the front and the back. Transverse is a cross cut, right, or a cross section. Cross cut would be cutting you into top and bottom halves, okay? So the 3 again to review is the median is going to cut you into equal left and right halves. Median section, cutting you right between the eyes like that, okay? Any sagittal section is anywhere along that same plane, but anywhere as long as it's cutting you left and right, okay? Coronal or frontal section is cutting you, dividing you into front and back halves, right? Or front and back sections. And then the transverse is the cross cut that cuts you and divides you into top and bottom sections. Okay. So really the only term that we use mid-sagittal is when we're talking left and right. We don't say mid-coronal, mid-frontal, or mid-transverse, anything like that. We normally just say those terms, but median and mid-sagittal is the only one that we use here. So this is some pictures. If you want to look down here, some scans. This would be actually a PET scan that shows a mid-sagittal section where you're looking at the person from their right side looking towards their left side. They're facing forward, so it's a lateral view. You can see the rectum and intestines. This is a coronal section where it's cut this person into front and back halves. So you're now looking at a slice like you sliced them from the front, right? This is a cross section showing you as you were looking at somebody from the feet towards the head. This is their spine, and would be their belly button up here, and their liver and spleen. You can see their body they're laying on their back, and you're looking at their feet going forward. Next is going to be the body cavities. Okay, so there's two types of body cavities here, or two sections that are important to know. We're going to have the dorsal body cavity, and we're going to have the abdominal or the anterior body cavity, or the ventral body cavity. So we usually just say dorsal body cavity and ventral body cavity. And in this particular picture, the yellow is the dorsal and the red is showing ventral. All right, so these are going to show protection and provide protection to different organs that are housed within them. I already mentioned dorsal and ventral, so let's go ahead and talk about what's in the dorsal cavity. Dorsal cavity is going to be subdivided into two other cavities, one being the cranial cavity that houses the brain and is protected by the skull, as well as the spinal cavity that houses the spinal cord and is protected by bones of the vertebra, right? So what you have to know here is basically the brain and the spinal cord make up the dorsal body cavity. Brain being housed in the cranial cavity, the spine being housed in the spinal cavity. Now, the anterior or ventral body cavity is a little bit more complicated. It's not super hard. There's just more sections, okay? There's one thing that divides the two parts of the ventral body cavity, okay? You have the thorax or the thoracic cavity that houses the lungs, and then you have something called the abdominopelvic cavity. Abdominopelvic cavity actually houses two subdivisions within itself, which is made up of the abdominal cavity and the pelvic cavity, okay? So let's go ahead and talk about these. The thoracic cavity is the cavity that is superior to the diaphragm. Here's the diaphragm, it's the muscle that helps you breathe, right? And this is going to house your heart, your lungs, and some other organs in there as well. Lymph nodes, trachea, things like that. Now, there's a central portion that houses that part right in the center part of the thorax, in the sternum area, and that's called the mediastinum. Okay, the mediastinum is the central region that has the heart, the trachea, and a couple other organs there as well, protected all by the rib cage. Okay. Next is the abdominopelvic cavity, and as I mentioned, the abdominopelvic cavity encompasses the whole abdomen as well as the pelvis together. This is the cavity that's inferior or below the diaphragm. All right, and the superior abdominal cavity, this cavity here. All right, when I say superior, it's superior to the pelvic. It's got the stomach, liver, and some other organs. And then the pelvic cavity, which is inferior to that, contains reproductive organs like bladder, reproductive organs like uterus in a female or testicles in a male, prostate gland in a male, bladder and rectum in both sexes. So there's multiple things housed here as well, and that's protected by a bony pelvis, where the abdomen is only protected by trunk muscles. So this is probably the weakest area of the body, considering that there's no trunk muscles, or excuse me, there's no skeleton protecting this part of the body. And there's no physical actual structure that separates the abdomen from the pelvis, just a heads up. All right, next is going to be some abdominopelvic cavity subdivisions. All right, this is how you break up the abdomen into different areas. This is important when you're describing pain or describing certain symptoms in your notes, and also to other medical professionals. in order to notice where you're talking about here. So there's 4 quadrants. You just break them up. Remember, a quadrant is each quadrant. And there's going to be actually 9 regions. And this gets somewhat complicated, but I'll show you the regions here in a second. All right, so the first thing we're going to talk about is the abdominopelvic quadrant. Okay, so you have the left upper quadrant here, okay, houses the stomach, portion of the stomach. The left lower quadrant houses mostly the small intestine here and part of the large intestine, half of the bladder. The right lower quadrant houses the appendix and the cecum, okay? And also in the right upper quadrant has the liver, gallbladder, and part of the the ileum, okay, and also the duodenum here. Now, you're making a line from the pubic symphysis. I'm sorry, the pubic symphysis down here to the xiphoid process. Drawing a line there and across. Okay. All right, so here's a couple of the different organs, as I mentioned, that are found in these different areas. Now, this has broken the abdominal pelvic cavity into multiple subdivisions. So we had the quadrant that we spoke about here, but then you break those quadrants up into subdivisions, which are 9 of those, okay? These are interesting. It gets a little bit more complicated here, but you've heard these terms, I'm sure. If you have not, the hypochondriac region means the under the chondric, the chondroids and cartilage here, the costal cartilage. So chondro always means cartilage. So right under that region, so right here is your hypochondriac region, or under the armpit. The left lumbar is right your lower back. The epigastric is above the stomach region, right here at the xiphoid process. Hypogastric is your pubic region down further. Right iliac or inguinal region is your right groin, and your left groin is your left iliac. And then, of course, the umbilical region is right there over the belly button and a little above it. And if you look on the right here, it shows you a couple of the divisions and how they're divided, as well as the organs that are found within them. There's a few other body cavities that we don't really go over yet in this particular introduction, but there's oral cavities, of course, and other digestive cavities, right? Like your esophagus. You have nasal cavities, all in here, your turbinates, your oral cavities, down your throat. Nasal cavity, as I mentioned, you got orbital cavities, so down here behind the eyeball. And also you have middle ear cavities, right? So let's go ahead and do a review. If you were dissecting a cadaver and wanted to separate the thoracic cavity from the abdominal cavity, which type of section would you be making? So you want to cut the thoracic cavity and separate it from the abdominal cavity. You should be making a transverse cut or a cross cut, right? Transverse section. Next question says, which of the following organs are in the abdominopelvic cavity? Spinal cord, small intestine, uterus, or heart. Abdominopelvic. It can be more than one here, right? Abdominopelvic, I'm going to say small intestine and uterus, right? Small intestine and uterus. All right, let's do this case study real quick. Joe's a 27-year-old male who went to the emergency room where he complained of severe pain in the lower right quadrant of his abdomen. He has a fever and said this has gotten worse over the last few hours. What is the most likely diagnosis? So lower right quadrant of his abdomen, he has a fever. If you remember correctly from the last picture, the lower right quadrant is where the cecum and the appendix would be housed. So I believe that with the fever, as well as gotten worse over a couple hours and severe pain in that area, it seems to me that it's possible that this patient may have appendicitis. So that would be important to check out. All right, so that's about it. I'm going to stop there, and I'll continue with some more lectures later on if you guys are interested. So everyone.